Slowly, our communities are starting to rebound from the coronavirus pandemic, but in our hospitals, the stress level remains high. News 5's Patrick Nelson shows us the work that's going on to help our physicians and frontline medical workers cope with the challenges.
During the last few years, physicians and frontline medical workers have been some of the most vulnerable people to suicide. It's why some of our local medical workers have come here to this park in Colorado Springs to literally take steps to remind themselves and their colleagues that asking for help is a sign of strength, not weakness.
Suicide is actually an occupational hazard for physicians. It's an epidemic, and a silent epidemic.
A group of physicians, friends, and family are spending time running and walking 400 miles, a mile for each doctor's suicide in the U.S. last year.
I actually had a colleague that died by suicide, and I've carried her story with me over the years. And as I've become more and more interested in wellness, I've actually realized that suicide is actually one of the most preventable causes of death.
Preventable, but in the medical field, these tragedies are all too common. You may remember back in April, 49-year-old emergency room doctor Lorna Breen died by suicide while trying to help COVID-19 patients in New York. Her brother-in-law spoke with News 5 about what he and his family learned.
What our healthcare heroes and our frontline heroes need to recognize right now is before they were heroes, they were human. And Lorna was a human just like the rest of us. She was an amazing aunt to 8 wonderful nieces and nephews. She was an avid snowboarder and she traveled the world. She was highly skilled at her profession, and everything she did was with that in mind. In fact, there are stories of her saving lives of individuals in airports who fell down and collapsed. What folks need to understand is that this can happen to anyone, and it can happen as fast as it did with Lorna.
The pandemic has added even more challenges to an already high-stress profession. While our doctors continue to be high risk for mental health problems, those in the profession say they remain hopeful.
The silver lining of the pandemic is it has broke down some of the barriers to actually talking about suicide, talking about the depression and isolation that we're all feeling right now.
Remember, you don't have to be a mental health expert to assist someone who is struggling. Sometimes it just comes down to knowing the resources and being able to connect that person with an expert who can help. If you head to our website, KOAA.com/rebound, you can find a series of resources and crisis hotlines to help anyone who is struggling. Always watching out for you. Patrick Nelson, News 5.